Do you need a meal plan? Definitely not. If you've been prescribed a meal plan by a PT, coach, nutritionist, stick around for a couple of minutes and I maybe want to explain how we could do this a little bit better. My name is Evan Lynch. I am a sports dietitian and this is my explanation as to why you don't need a meal plan. So look, it's a common request and I would say it's a common misunderstanding, to be fair, on your behalf, the general population or public, as to how you feel you are supposed to go about changing your diet, changing your body, improving your health, your performance, whatever it is. Meal plans, macro tracking, those are generally the only frame of reference we have when it comes to what do we expect from a nutritionist or a dietitian. And I think that's fair to say, and I can almost see you nodding along in agreement. Unfortunately, the evidence doesn't actually suggest that meal plans are in any way helpful, because diet is not a prescriptive behavior. Diet is emotive, it's environmental, it's social. You can't prescribe yourself, and I can't prescribe a patient a diet, much like a doctor might prescribe an antibiotic or a coach might prescribe a running program and expect you to stick smack bang to it. It just simply doesn't work like that. If only it did, weight loss interventions will be really successful. Oftentimes when I have this discussion with patients and with clients, they'll give me some resistance and they'll say, well, you know, I got a meal plan and I tracked my calories before and it worked, ... for a while. And there's a reason for that. So let me explain. If you have to rely on meal plans, macros, restrictive protocols, whatever it might be, it can feel like you're in control because you're following a very strict set of rules. Unfortunately, you're only going to be on track while you're following that strict set of rules. And once your 12-week program comes up to an end, or once Christmas rolls around, or you have a tough day at the office, or your friend Sharon is mean to you, whatever it is, you might find you go off track and find it really hard to come back on track again. And that's because meal plans fundamentally miss the point. Generally speaking, if 100 patients came into my clinic with a variety of different problems, healthy eating, eating regularly, tapping into appetite regulation, making smart choices, that's really what does the bulk of the lifting. Meal plans were initially curated as a convenient way to send that message home. Because if you go to a nutritionist or a dietitian, it takes a lot of work and expertise to portray the nuanced points of behavior change and psychology and the psychology of eating in a single consultation. It's easier to say, here's a meal plan, see you later, best of luck. It doesn't help you though. Couple of things. If we follow a meal plan, number one, you're eating the same thing every day, which is a criteria of disordered eating. If a patient tells me I eat the same thing every single day, I would screen them for an eating disorder for sure, okay? So that's probably not great. Number two, meal plans are rigid. I kind of pointed to this earlier on. You might follow it until something disrupts your flow or your routine. The very fact of here's a plan of what to eat infers you cannot have anything that's off plan. I hope this makes sense to you. If this resonates with you, or if this is something that you've struggled with, maybe you had a bad experience with a restrictive plan in the past, or you've gone to diet camps where you've been given plans and the inference is, you know, whatever's not on this broccoli, rice and chicken plan is automatically bad or counterproductive to weight loss. If I was to ask most of my patients, you know, what foods do they think are bad, it's generally things like chocolate, ice cream, crisps, which, surprise, surprise, don't end up on meal plans. So that very, I guess, well-intended interaction between a professional and someone they're trying to help can actually end up sowing the seeds of binary views on food, good or bad, on and off eating behaviors, and generally speaking, a food complex. And that kind of leads me to my next point. If we, first of all, decide as a practitioner, we're going to skip all the psychology, all the heavy lifting, we're going to condense our message into a meal plan, there you go. We are number one, not helping the patient. We are number two, raising their risk of engaging in disordered eating. We are number three, sowing the seeds for a binary relationship with food. What are we doing number four? We're undermining their own skills, trust in their own ability to make healthy choices and their own intuition. It's the dietary equivalent of getting an adult to go to the toilet and wiping their ass for them. As a healthcare professional, that's not my job. My job is to help people. So with all that being said, I've fairly clarified my stance, and all dietitians' stances for the most part, with very few exceptions, with respect to weight loss or health behaviour change, that we do not believe that meal plans are the way. What do we do? Where should we start? Number one, and it's very boring, we should start thinking about healthy eating. Most patients, when asked, I see you want to make some changes here and I see you want to plan, but could you give me an example as to what healthy eating looks like? They can do that perfectly well. It just turns out that because they've had so many experiences with nutrition professionals in the past, and they've been given plans that are very strict and rigid, which by the way is not healthy eating, and it differs from our balanced view of healthy eating that we're taught in school or the food pyramid. As a result of that, most people don't trust their own intuition or their own idea as to what eating healthily should look like, which is a shame because most people are absolutely bang on when you ask them to describe what healthy eating looks like. So that's the start. We ask the patient, what do you think healthy eating looks like? We then ask, do you think you could try and eat 3 main meals a day? Inject a bit of protein, inject a little bit of colour into that. Generally the answer is, yeah, I think I can give that a go. Question number 3, do you think we could throw some snacks in there? Healthy snacks, and what do you think those should look like? Generally the patient can list off a couple of different snacks. And what I might ask then is, okay, patient or client, let's do an experiment. For the next 2 weeks, I want you just to simply try eating healthily, and whatever you think that looks like, that's absolutely fine. And almost without exception, when I link in with that patient or client 2 weeks later, they've done an excellent job of eating healthily, they've improved their behaviour, they're probably not eating as much junk food because they're eating a well-balanced diet and they're not restricting anything, so they don't feel the need to go off track at the weekend or binge. And that's all. Unfortunately, it's very hard to market that because it's extremely boring, but I guess that's why I wanted to make this video as a public service announcement that you don't need a meal plan. Someone trying to sell you a meal plan ultimately does not know how to help you, and by accepting the meal plan, you're taking on the help that you've been told you need, but it's not the help that you deserve. So we should do better. So feel free to share your thoughts in the comments here. I am interested to see what you think because generally this is not common consensus, but let's make it so. Let's have a chat in the comment section. Until next time.